Welcome to COVID Unmasked. I am Julia Jordan-Zachery. I want to offer a little bit of a trigger warning. Listener discretion is advised. Some episodes may touch on troubling topics such as self harm, including cutting, loss, and death, might be hints of sadness. So I encourage you all to do what you need to do in order to take care of your spirit as you engage with us in Black women's journeys through COVID 19. When Black women show up, we bring our wisdom, resilience, and more importantly, we bring our truth.
She wasn't personified just into one woman. She seemed all too familiar to me, almost as if she was fam.
Grab your tea.
Welcome to COVID Unmasked. I have two amazing guests that will talk about their experiences with birthing during COVID and what that's looked like. And just basically just to understand what is it that Black women need, not just during COVID, but in this quote unquote post-COVID world. As is my norm, I allow my guests to introduce themselves, sharing with you, our audience, any and everything they need you to know in order to understand the story that we're sharing. So I'll turn it over to whomever wants to start first.
My name is Shamara Wyllie Alhassan. I'm an assistant professor of African American Studies at UCLA. Now I just transitioned from ASU. I was pregnant in 2019. I had just graduated from PhD program and I was moving across country to Arizona. And so the first semester that I taught at Arizona State University, I was, doing my normal pregnancy. Everything was going on fine. And then the second semester was when COVID began that March, and I was due in April. I was due April 26th. So I gave birth like right at the height of what was happening at the time. People were getting sick. I think one of the first cases of COVID was actually in Arizona. And, nobody really knew what was going on. I was seeing a midwife at the time, and, she was just like, keep an eye on the news, but nobody really knew how it was going to impact women who were pregnant. But at some point, when people started dying and it became more obvious that it was like, this is not just like a flu, this is actually a airborne disease. And I think at that time, actually, there were still worries that it was like on doorknobs and, people didn't know like exactly how COVID was spreading. So at some point, my midwife was just like, we're going sort of into lockdown mode and of course the nation locked down, including Arizona. And that meant that, we were just inside and isolated. And at that time, I was still teaching. We had to move our classes online. And I was teaching this class on Africana religious studies. And we shifted our conversation to think about what was happening in our world and how Africana based religious practices might be able to help us to think about or deal with or handle and work through everything that was happening, from COVID to the woman that got shot in her bed.
Breonna Taylor.
Breonna Taylor, oh my goodness.
Yes.
So Breonna Taylor had gotten shot that March, and then there was another one that was jogging, the Black man that was jogging.
Yes, Ahmaud Arbery.
Ahmaud
Yes.
Arbery. And then there was, of course, George Floyd that happened May 25th, which was actually, so I gave birth April 26th. George Floyd happened May 25th. And I'm one of those people that need to be out and just find themselves in a protest. And it was a lot between trying to care for a newborn baby, being in isolation, being afraid of like people coming to like, they want to carry the baby, they want to hold him, walk around with him, things like that. To balancing like my instinct to protect my child, but also my instinct to protect my people and be out on the street, I think was a lot. And there was a certain heaviness that came with that experience. But I'll sort of stop right there and let Keisha also share a little bit.
So my name is Keisha Bentley-Edwards. I'm an associate professor in the School of Medicine And I'm also the Associate Director of Research for the Samuel Du Bois Cook Center on Social Equity. And I was parenting as well during this time. And just for some context, I'm a developmental psychologist, and I examine racism, gender, and culture, and look at how all those things intersect and have an effect on health and education and families. And during the time of COVID, all of those things were happening at one time, right? So, I was often like tapped to talk about, oh, can you explain racism, how it manifests, what does it look like in this arena? What does it look like in that arena? And it was just very bizarre because for me, it's chaos. Like I'm looking at the world is in chaos. And suddenly people are interested in racism in a way that they want to know more. Not just like, oh, some people wanted a reading, like a book club, but folks really want, like, know what is it? What can I do? And they wanted this in-depth knowledge, and my expertise became in demand, especially working in a school of medicine where people understood health disparities, but they didn't understand social context. So I had this multiple worlds I was living in, right? Where I had to be this academic and really talk about things while at the same time, at the time, 3-year-old twins were home, and they are not sit quietly with a book type of children. They have strong voices, and I raised them to have strong voices. But transitioning to Zoom, it made things a bit of a challenge. And so trying to be a supportive parent, while also being an expert, and then at the same time, trying to keep my family safe, both the family members in my household as well as across the country, and battle the misinformation. So the exhaustion was very real, but it was really a lot of just working on autopilot. So there are certain parts of it of that time period that I don't have a clear memory on, because I had a sudden death, and I didn't have during 2020. In 2021, I had a young family member who passed away from COVID.
Sorry to hear
But
that.
it's young. Anybody passing unexpectedly, especially from COVID, is rough. But a young cousin with young children was especially hard. But in 2020, my in-laws passed. My sister-in-law passed unexpectedly from an aneurysm that, getting an ambulance in New York in May, was a tough go. So things that may have been able to be treated quickly couldn't be treated quickly. When she had a bad headache, she couldn't get into the doctor's office, and the doctor had to get clearance before she could go in to get tests to see, what was causing her headache. And so it was like, okay, we can get you in 2 days, but she didn't have 2 days. And so having, someone who's very healthy and vibrant pass away suddenly, and we couldn't do normal funeral mourning rituals, right?
Yeah.
So we had like a Zoom funeral, and it wasn't really a funeral. It was just always like, and even just being able to get her body so that, it wasn't in some freezer for 2 or 3 months, which in New York, it was about a 3-month delay before you could get your loved ones. And so fortunately, the Black community, we have family members involved with funerals and mortuaries. We were able to retrieve her remains. And so I bring up all this, probably too much detail, because we were also dealing with my brother-in-law who had cancer. And so it was in all the protocols to be able for my husband to be able to go with him to the hospital became very difficult, because he had to go in the hospital for a month and we couldn't go visit him. We had to rely on nurses calling us, and sometimes they were too busy. They couldn't call us, so we didn't know what was going on. So all of this, And it's ironic, I was just talking about this a couple days ago, while people are asking me about, well, how do you know that this is racism that we're seeing? Right? George
Mm,
and Breonna
mm,
Taylor is happening, George Floyd is happening, and having to explain racism to people who should know better. And that was tough, and maintain my cool because I'm in a learning context. So I still have to make sure that people are learning and not make it about me. But me was really feeling it at that moment. You know what I mean? Like I realized it must have been in early to mid June when I realized that for a lot of the people I work with, that COVID, the fight for racial justice was an academic exercise, and for me, it was a frightening life experience. Like, it was something I was
mm,
experiencing. It wasn't something that I was watching on the news. So I was experiencing it, and I was, explaining it at the same time to people who should have known better. I was glad that people realized that, oh, maybe I should learn something, but it was hard. Like, you lived on this planet for 50 years and now you're interested, those types of things. But
right.
having
Mhm.
to look at the bigger picture and say, okay. But there were a couple times when I definitely shut down because I got so frustrated that I had to take a break and take a breath
Yeah.
from it all.
Thank you. Thank you both for those dive right in introductions, right? This is why I love Black women, and how we engage in storytelling. And of course, like I mentioned, we have questions, and questions quickly went out the window because
Yes.
yes, you both speak to this duality, right? Of what it means to be, in Shamar's case, a kind of community engaged person giving birth and having to
Mhm.
protect a newborn, and also dealing with motherhood. And Keisha, you talk about this duality. On the one hand, I am in this space of teaching and learning, and I'm expected to be this expert, but there's this woman that's having these real life experiences that needed help and support and understanding. And so let's talk a little bit about, and we're going to come back, Shamar, to the mothering, and we're going to come back to the social justice stuff. But let's talk about you all as individuals, as mothers, as educators, as community engaged people. How did you find care? And what did that care look like for you? Who did you all turn to say, Shamara, I recognize you're a new mother. It's going to be okay. Keisha, I recognize, yes, you are a teacher and you're experiencing all of this loss and change. It's going to be okay. And let's not be superficial and talk
Mhm.
about, self care as
Yes, no, I
understood
understand.
in, right, as
Yes.
understood in a capitalist system. What was care like for you all? And how do you continue that care? Right? How is it traveling for you? How are you protecting your psyches, your bodies, your mind?
Well, I mean, that is the question, right? And I think for me, I think I'm still sort of working through that. But at the time, I am blessed with an amazing partner who was able to hold me during that time because I was literally like I literally was like, I'm sitting on the couch one day after my son was just newly born, maybe like a couple weeks, because I think George Floyd happened on the 25th, and then things started to pop off shortly thereafter. And of course, I'm in the sort of newborn cluster feeding phase, which I don't know if y'all remember, but the baby basically stays on your chest for all day. So
Mhm.
I was like, oh, we started seeing people marching in the street and Black Lives Matter. And I was like, oh, I need to be out there. I need to be out there. And, I remember my partner was just like, so you want to go out in the street and not breastfeed your baby. And I have to give him formula. And I was like, no, you will not give him formula. So, so that quickly made the decision for me in that way. But having a beautiful partner that allowed me the space and time to sort of gather myself in the moment, and just remind me of, where my priorities were in that particular moment, because
Mhm.
they were, which were to take care of our son. And then also my parents. My mother had come down during COVID. She actually, what I didn't share before was that I gave birth at home instead of
Mhm.
at the hospital, which we were scheduled to go to the hospital. But I think my body just was not having it because at the time there were new policies that were put in place for birthing mothers. And in some states, that meant that women in the maternity ward were not allowed to have anyone there to support them.
Yes. Yes.
Luckily, in Arizona, did allow at least one person to be in the room. The problem with that was I wasn't choosing between my husband and my mother. So I was like,
Mhm.
they just both
Mhm.
need to be in the room. So I don't know
Mhm.
how
Mhm.
that's gonna work out, but it's just gonna have to work out. And I remember my midwife explaining to me the new policies that had been put in place. And, I broke down crying. I was like, that we just not gonna do that. And so I think my body was just like, no, we're just gonna have this baby here, and then, we'll deal with the repercussions afterward. And so luckily, I was able to have my son at home, and my mom caught the baby. My husband was right there,
Mhm. Mhm.
which is
Mhm.
not necessarily advisable to have unassisted birth. So we're not
Mhm.
sort of advising that. But I
Mhm.
think what it did reconfirm for me, because I think it was confirmed in my first pregnancy, my second son was born during COVID, was that our bodies are able to know what they're supposed to do. And at times, even when you are in the hospital, I don't know if you've had this experience, but with my first son, we didn't think I was in labor, so nobody came to help me even when I was in
Mhm.
labor in the hospital. So
Mhm.
so I think, through that experience, I was like, "Oh, no, I can do this," because I had to do it before, even when I was in the hospital with the medical professionals. Um,
Mhm.
and so, luckily, we're able to have a smooth labor process and delivery process and gave birth to a healthy baby boy. But it was really through the grace of my family that I was able to get through that moment. And then later on, it was as COVID sort of went on and as I was mothering my children and, to just also echo Keisha, like being somebody who has expertise in race, racism, gender, people were sort of bombarding you with all of these requests of like, can you talk on this? Can you be a part of that? And I remember in my school that meant that they formed an anti-racism committee just after the murder of George Floyd and during the protests. And of course, who was one of the first
Mhm.
people they called to be on this committee?
Mhm. Mhm.
Right. Right.
Yours
Yes.
truly.
Mhm.
And I remember actually calling Julia and we
Mhm.
have another friend, Camille, and talking to them about this request of, having to serve on this committee. And I remember Julia was like, is that the best use of your time? And do you have the capacity
Mhm.
to do that at this particular moment? So it was questions like
Mhm.
that
Mhm.
that really helped me to reflect on what I actually have the capacity to do and that I too am a person. I too am a human being in this context.
Mhm. Yes, you
And,
are.
yes, I have this expertise. Yes, this is my scholarship. And so it is easy in that way to do certain types of things. At the same time, it is not easy to parent a newborn and a then 3-year old during the height of COVID,
Mhm.
as well as all of this racial strife that is happening in the country. And being
Mhm.
in a state like Arizona, which is a very white supremacist state. And of course, the United States is a white supremacist country, but definitely you have sort of concentrated areas, Arizona being one of the
Mhm.
strongholds of that. um,
Right.
Mhm.
Right. Mhm. Mhm.
um, and so and then the school that I was working, I was at that time I was assistant professor of religious studies in the School for Historical, Philosophical, and Religious Studies at Arizona State University, and the school is predominantly white. It's a predominantly white space. It knows itself as a white space. And so navigating those spaces, and I was supposed to be on leave in the fall semester of that year because they don't have maternity leave. if you give birth
Mm.
awkward time of the year. I didn't
Mm-hmm.
realize that you had to time your birth with like the academic calendar.
Academic calendar. Yes.
In
Yes.
the future, I'll make sure, you know.
Mm-hmm.
Get it right.
Mhm.
But instead of giving you maternity leave, what they do is they give you a reassignment of duties. And so they allow you to, you know, maybe do like 100% research and then like no service, no teaching. So that's what I was supposed to have in the fall. But because I was on this committee trying to do diversity work, I was literally organizing stuff and doing stuff for the school because we had a lot of students, of course, especially the students of color, the few that we had who were really struggling during this time. And I was, you know, one of the people that my school was leaning on to
Mhm.
be a caretaker for these students,
Mm-hmm.
which I'm more than happy to do under normal circumstances and still
Mhm.
try my
Mhm.
best to do under those
Mhm.
circumstances, but also realizing that I didn't have necessarily the capacity to be able to do that. And then also realizing that doing that labor, performing that service also meant that I wasn't performing other types of labor that I needed to do to keep my job. Your research is the most important thing, especially at R1. And that's when Julia had invited me to be a part of this project this beautiful book that we were able to create, Black Woman and Dorona, which through working on that book, which I mean was an amazing experience to work with Julia and to work with all of the contributors, including you, Keisha. But doing that book really allowed me I think the time and space to practice that self-care and being in community with people who are thinking around not only the trauma of what we were living through at the moment, but also the ways that different folks were able to find joy in those moments and actually reading the contributions and then also composing my own contribution and trying to focus on that joy, which Julia was insisting that we not make it about death and death and death, even though that
Mhm.
was really a really big part of it and we were riding up against that backdrop, right? And there was a space for that, but it was also about healing and how we are able to endure and still find joy and peace even in the midst of all of the chaos, which I think is,
Mhm.
you know, really at the crux of how Black women have existed. Yeah.
Right. Thank you for that. Keisha, you wanna jump in here?
You know, for me, a lot of it, like I said, I was on autopilot. And so I was just like constant, working around. This is like when really truly got more on working with the hospital schedule. And so, meetings start at 7 a.m., sometimes earlier, and don't end till 7 o'clock at night. You might be able to eat during a meeting.
Mm.
And I think I know it was when, especially when my sister-in-law passed, that and I was getting really frustrated. I said, "Okay, let me take a breath." And then the same thing, one of those committees, came about, and I was like, "I should be on this committee to make sure, like, I wanna this is gonna be important. I want it done right." And, my husband, he looked at me and he just said, "It doesn't always have to be you." And
Mm. Say
and
that again. Say that again. Say
yes,
that again.
it doesn't always have to be you.
Has to be you.
And
Yes.
and I appreciated that space and the pause. And he was right. And I thought about it and I said, "You know what? Other people need to have the opportunity to do this deep dive and to figure out what works and what doesn't." Like, I don't mind jumping in, "Hey, I have a comment," and then coming right back out. But the constant meeting, for 6 months and a report and an action plan, I didn't have it in me. And I'm glad that I did not do it. I've been a part of the recommendations since then, but I'm so glad that I did say no. So that was my self-care, was getting comfortable with saying no. And also, and I said no, started saying no a lot to things, especially
Mhm.
things that would take me out of my home, like, and out into other spaces, especially when my brother-in-law moved in with us. We were really locked in. At
Mhm.
that time, he
Mhm.
was getting treatment for cancer. So we weren't going anywhere. If you wanted me to come in person, I was not doing it at all. Because I was like, we can't have any more loss. Like, my brother-in-law's health is deteriorating. The one thing we can control is how much exposure we get to COVID. So we
Mhm.
are limiting that exposure as much as possible. So really the other aspect of where I found joy was through like Zoom, having Zoom parties, birthday parties, and scavenger hunts with my daughter and my friends' kids, and in trying to make sure that they had joy in a childhood during, for us, which was about a year and a half of lockdown. It forced me to participate in that joy. And so that gave
Mhm.
me some respite as well. Because my girls are a two-person party, and you got to get with it to be a part of the party. So it was, but I can't say that I did true self-care and reflection until things started to open up again. And I started really thinking about, like, I need to take better care of my body. I need to make sure I hit these
Mm.
doctors. Like, I haven't gone to the doctors, I haven't gone to the dentist, like that type of self-care, more so than
Mhm.
like, let me get my nails done. It was more so like,
Mhm.
you need to get right so that, our family has experienced so much loss. You got to get right so that I don't want to be the cause of trauma for my children.
Mhm. Mhm.
And
Mhm.
and so I really said I need to get myself right. I'm
Mhm.
still a work in progress on that one.
Well, we all are. I call them COVID gifts, right? And not to
Mhm.
deflect away from all of the death, the loss, the sorrow, the fear. But in the midst of that, some of us were able to experience, again, what I call like COVID gifts, self reflection, the need to take better care of self, and those types of things, right? The ability to say no, to back away from things and say, I'm not the one who has to save the world all of the time, which, a lot of people walk around and say, listen to Black women, without thinking about the toll, and also without thinking
Yes,
about how they're pouring into Black women, right? So
absolutely.
there's an extraction model that even
Mhm.
existed with Black women during COVID. And we saw that with some frontline workers, the healthcare needs. And I think, we are both kind of
Mhm.
hinted at that in terms of giving birth, even being able to access doctors and things like that. So I want us to think a little bit about the lessons learned during the pandemic about healthcare inequity, community care, et cetera, and kind of the lasting impact on Black women going forward. What do we think we have learned around healthcare inequity, community care, and Black womanhood specifically? And how might we take these lessons forward?
I think that for a lot of Black people and Black women specifically, we learned that we were disposable to a lot of folks who make decisions in this country. We have a lot of the jobs, whether it was people working at grocery stores, home health workers, cleaning staff, nurses, and nurses' aides, where you had, and even like retail workers, people who worked in stores, and you had these high death rates of people who worked
Mhm.
in these types of positions dying from COVID. But when the vaccine came out, they were not the first in the priority. It was, if you were a frontline healthcare worker, yes, and that made sense. But even as the schools were shut down, you had teachers, you had police officers, you had people, it was prioritized that people who came in contact with high communities that were at higher risk, more so than the people themselves who were at higher risk.
Mhm.
So the
Mhm.
police officers who go into our communities, our crowded spaces, our crowded home communities, it was teachers who may or may not be teaching your children in person. It was the police officers was what really kind of got me, to be honest with
Mhm.
you. And so I think that a lot of people understood, and I know for me, one thing I always would say, but I really understood when it came to COVID, was that this country does not care about children.
Mm.
You know, they were willing to, like, we got to open up the schools because people can't go to work. We don't know what COVID's going to do to children, the long term effects. We don't know. And fortunately, so far, most of the, you know, kids can process and get over COVID in general more quickly than adults can. But there are adults in the schools too, right? And there are people at
Mhm,
home
mhm,
who may be more fragile and vulnerable. And so, you know, for me, I think that when I look at what people learned about how the healthcare care system looks at Black people and Black women as disposable, Black women were already the number one new business, like starting new businesses. And I feel that during the pandemic, you saw an even bigger increase of Black women starting their own businesses and going out on their own because they realized we can't count on, you know, major corporation this or a
mm,
big company
mhm,
to look out for me. If I want someone to look out for me,
mhm,
I have to be in charge of my own coins,
mhm.
right? So,
Right.
so I
Yeah,
think that that was a big
mhm.
lesson and the action that moved forward as part of COVID.
Essential workers. They're called
It's
essential workers.
essential.
And
Yes.
it's not 2
Thank you.
o'clock.
It's not 2 o'clock. Thank you so much. Essential workers. And it's so funny because
Yes.
I remember the second half because I would say they were essential but disposable. So
Right,
essential
right.
workers,
The
when it came
workers.
time when the vaccine rollout, the essential workers became disposable workers and
Disposable workers.
they were not prioritized in the same
Mhm,
way.
For me, COVID exacerbated already existing disparities
Absolutely.
with essential workers. And the reason why I say it because my mom is a registered nurse, and
Mhm.
at the time she was working in a psychiatric ward, one of the only psychiatric wards in the part of California that we live in, and there was no PPE. There was
Yep.
mm,
screening processes to see, you know, if patients or medical staff or the security staff or anyone was bringing in COVID to the facility. And of course, you have patients who are there locked in. I mean,
Mhm.
it's a psychiatric facility. They're supposed to be,
Yes.
they don't have leeway to just walk out, you know.
Mhm.
Or to
Mhm.
protect themselves in some type of way. And I think we realized, you know, folks who are incarcerated, folks who are in these positions where they're not able to just isolate,
Mhm.
you know, are being disproportionately victimized in these situations. There were a number of stories where, because nursing staff and doctors didn't have the protective equipment, they weren't going in because they were trying to also protect their own lives.
mhm,
Absolutely.
You had this sort of dog eat dog scarcity model that
Yep.
unfortunately I think, you know, those of us who I'm not in the medical field, but I'm in proximity to it in terms of my
Mhm.
those of us who knew about disparities prior to COVID were just like, our medical system in the United States does not have the capacity to handle such a
Mm.
crisis. Um,
No,
and it didn't have the capacity to handle what we were already handling prior to
exactly.
COVID happening,
mhm, mhm,
let alone when COVID happened to try to transition into a lockdown, to try to still make sure that people got their meds, still got taken care of. Even the sort of draconian policies around, I was talking before about the ways policies changed at hospitals. Um,
Mhm.
and you had to go and give birth, and one such policy was not having family members or friends or anyone in the room with you in some states, or only having one person in other states, which is a draconian policy in and of itself, because anyone who knows
Mhm.
anything about maternal care and
Absolutely.
processes know that you need your support system. And the other issue was that you had to wear a mask during labor. And I don't know if
Mhm.
anyone has been in labor before, but but when you're pregnant, already you can't breathe, okay?
Yes,
Yes,
yes.
It's
yes.
already the problem. So if you add a mask to that and you're trying to, like, you know, push a baby out, it's almost impossible, okay? And,
mhm,
after I gave birth at home, we had called the ambulance and we'd gone to the hospital, and it seemed like they were more concerned about whether my mask was on my nose
Mhm, mhm,
And,
mhm.
whether myself was okay and the baby was okay. I'm like, yes, I'm gonna try to
Look,
keep my mask on, but I just
look, I'm glad you had your mask on because those ambulance workers were around a whole bunch of stuff to protect you.
Yes,
right.
yes.
Yes,
That's true too, right? So you're
yes, yes,
Mhm.
yourself and I know they're trying to protect themselves in the midst of it,
Right.
but
Mhm.
also just in terms of some of the medical needs that some folks
yeah,
that are, the inability to mask, was also
absolutely.
that folks didn't necessarily talk about. And as somebody who was pregnant, during COVID, I can attest to the fact that I was already struggling to breathe. Okay.
Yes,
That
Yes, yes.
absolutely.
was not helping. So I think the conversations that then transpired during COVID and, sort of in this sort of well, I think people are saying we're in a post-COVID world, but of course we're not because COVID is still continuing.
Mhm.
Mhm. It's still here. Yes, it's still here. Mhm.
Right. People have started to reflect more on what it means to be prepared for such a pandemic in the future, what it means to have folks in society that are considered disposable, that are considered, well, you just have to suck it up because people need their groceries, you know? And
Mhm.
it's like,
Mhm.
how do we build a society where everyone can be cared for? Everyone can, especially those who are the most vulnerable amongst us, can be cared for. And as you mentioned, about the children were thought to be sort of immune at some point to COVID.
Yes,
And it's like children also have underlying conditions.
absolutely.
Many
Mhm.
children
Yes.
have type 1 diabetes and other types of respiratory illnesses that were also passing away from COVID.
Absolutely.
So
Mhm.
I think we still need to reckon with the ways that we have purposefully put people in harm's way, including our children, and are still doing that, today, uh,
Mhm.
because we need capitalism to keep churning. We need to still
To
go to
keep
work.
churning.
Yep.
Right. Right. All right. So we need to begin to wrap up a little bit, and I want to give you a moment to offer one thing. So we're talking, and we've done this beautifully about the life cycle of Black women. We've talked from birth to death, everything in between. We've talked about the intersection of COVID-19 with existing inequalities, with police brutality, with racism and anti-blackness, etc. And so we've really had this rich conversation of how COVID mapped onto previously existing illnesses in society.
Mhm.
We've talked about how we found joy, how we cared for ourselves. We talked about failing structures. Shamar, you mentioned beautifully we need to think about how do we make sure that people are cared for, particularly our most vulnerable people, right? So if you can give our listeners one thing that you want them to take away from our very rich conversation, what is that one thing?
One thing that I learned is, when I was writing the piece for the book Black Woman in Dorona, I was also reading a book written by Callie Gross and Ramey Berry, which is a Black woman's history of the United States.
Mhm.
And in the book, they talk about Nanny Burroughs, and she had a motto for
Mm-hmm.
her at the turn of the century called "We specialize in the impossible or the wholly impossible." I took it as like a mantra during COVID
Mm.
that Black women have always specialized in the impossible, that we've always found a way when there was no way, and that even as I had prepared to give birth to my son unassisted by medical professionals at home, I realized that, our bodies can do incredible things if we pay attention and we listen to our bodies and we listen to our ancestors in terms of Nanny Burroughs, that we can continue to do incredible things. And I think that's what I witnessed Black women do throughout COVID. And I hope that listeners, as they tap into Black women's stories around COVID-19, that hopefully they'll be able to take a page from their books about how to survive and thrive even in the midst of chaos.
Sorry, I'm sitting here thinking, and I'm gonna take a different approach because I'm always like aim high, aim higher. But I've also been in deep thought about how we look at resilience, Black girl magic. And I know, Julia, you have a book on Black girl magic. And I've written about this a few times, like the problem with Black girl magic is this reliance on Black women to save the world, our families, and ourselves, often unassisted. And I guess the one piece that I would say is that, you don't have to be the superhero. You don't have to save everybody. You can ask for help. You can say no. I know that's more than one thing, but it's all related. It's
It
all
is
related.
beautifully related. And I thank you all. And I'll say, when we talk about Black girl magic, what people are missing is we're talking about labor. There's no
Yes,
hocus pocus.
exactly.
It is
Yep.
labor.
Labor.
And we thrive through our labor, birthing
Yep.
ourselves time and time again, right? Because part of the underlying story that I heard you all share is how you birthed yourselves during COVID, right? And
And
therein lies the labor. Yes, I'm listening.
well, no, and and the thing that I've been really meditating on is imagine if we had the support that we needed. Like, you think what we're doing is magic now? Imagine if we didn't have the adversity, the manufactured adversity that the system puts on us. You think that we're magical now. Imagine if we didn't have to deal with so much manufactured systematic adversity. We really would be you'd be able to see how unstoppable we are.
Amen. And we are. Thank you all for that.
Thank you for engaging in this conversation. I encourage you to take a moment to reflect on all you have heard and to think of your story. For more stories, resources, to contribute, and for updates on the larger Black Women Talk COVID project, I invite you to visit the website blackwomentalkcovid.com. That's blackwomentalkcovid.com. Remember to take care of your spirit. Until we meet again.